what would you say has been the biggest change you and your child have noticed? You first and then your child. And when did you start to notice changes?
So with me, I stopped sneezing. Like, I mean, it was like so clear. It was a clear difference from what I was suffering, and after I started taking the drops, I I think it's reduced drastically. I almost maybe stopped sneezing almost immediately. I would say immediately within a month or less than a month, actually.
Hello, everyone, and welcome to Connecting the Dots with Dr. Ashaye, a great place to be if you desire to take charge of your health so you can live fully while enjoying doing what you love. If this is your first time joining us, welcome. I'm Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of InTouch Primary Care in Sugar Land, Texas. And here we make it easy for people to achieve and maintain good health. We provide stress-free medical care so you can feel well and fit enough to chase your dreams. This whole month, we're going to be talking about a new topic, allergies, specifically environmental allergies. And I'm going to answer questions like, are allergies harmful? We're going to talk about, is there a cure for allergies? Um, are there things that you can do to help allergies outside of medications? And so much more. I have very special things coming up this month, and I'm excited to share them, but we'll talk about that over time. So if you or someone you know has allergies, I want you to stay tuned for these series because they're going to be really helpful. You really don't want to miss this. So we've talked about allergies for a few weeks now, about symptoms, we've talked about testing, effective treatments, including over-the-counter medications. And we've even had people speak about their experience with treatments, and there are several effective methods for treating allergy. Allergy drops, though, have been around for several years, and they are much more convenient for addressing allergy symptoms, and in my opinion, much more effective because people actually follow through with treatment. And today, to end this series, we have another special guest, and she's going to share hers and her child's experience with allergy treatment with allergy drops. So for those of you that are wondering about treating the root cause of allergies, you can hear firsthand how it works. So thank you so much, Banke, for joining us today. Truly appreciate you being here to help our listeners.
Thank you for having me.
So many people suffer with allergies. They've had it for years. They don't realize that treatment can really make a difference for their quality of life. And some of them are actually even needlessly exposing themselves to antibiotics because they think it's a sinus infection. Some of them are taking over-the-counter medications frequently and they're experiencing unpleasant side effects. But you, Banke, and your child, you guys decided to go for a more permanent solution and treat with immunotherapy, specifically with allergy drops. So can you tell us kind of what symptoms you and your child had and for how long you had symptoms when you decided to do testing?
Alrighty. So I will start with my daughter. She had some form of rashes on her skin, especially around her joint areas, under uh elbow, kneecaps, and just around her skin and her face as well, and even on her neck. I believe behind the neck as well. And that was really what she had. That was what the majority of her symptoms. It was just more on the physical side. But mine was more of sneezing. I was sneezing a lot, like consistently sneezing. In a day, I could sneeze up to maybe 30, 50 times. And I didn't understand, what was causing it. So that was why we came to you.
Okay. So allergies have been associated with many conditions. So you mentioned the rashes, which turned out to be eczema when I saw her. And other people have had like poor concentration. Some people can't really perform well in sports. Some people have difficulty at work, probably because just being productive because they're so uncomfortable with the symptoms, or even sometimes the medications cause side effects. So did you experience any of those other types of symptoms? And why did you decide when you got diagnosed to actually get treated?
So when we were experiencing the symptoms, I I mean, right now I honestly cannot remember all the things that were happening at the time. But one thing that I can speak for sure is I could hardly sleep um, all through the night because I would always get up with itchy throat and, scratchy throat and things like that. So, of course, that affected the quality of my sleep. And for my daughter, it was more of, she wasn't comfortable. She couldn't wear some certain clothes. She always had to cover up, and she plays sports, and especially she plays tennis. So for her, even in the summer, she always had to cover up because she wasn't comfortable exposing the symptoms she had. So I would say that the fact that it was kind of affecting us in different ways was what really made me seek out treatment. And when we approached you and we carried out the test and you fully diagnosed what the issue was after we did the blood test and stuff like that, identifying what was causing our symptoms, for me it was a no-brainer. I mean, I would rather live a comfortable life, not having to sneeze and use antihistamines, over-the-counter antihistamines, because they would make me drowsy sometimes, or sometimes I wouldn't be able to sleep. And most times I would even forget to use it. And even when I use it after a while, I felt like it wasn't working. It didn't make any difference. So when you gave us the different options we had, and you had talked to us about, what the possibilities could be of eventually getting off of the symptoms we were having at the time, and that it could be a permanent solution to the what's it called now,
The
to the
allergy.
allergies we had. For me, it was a no-brainer. I was like, I'd rather take my chances instead of suffering. My daughter and I suffering. So for me, it was just easier to deal with.
Okay, so allergy drops and shots are great for people for year-round allergies, which both of you pretty much had, and those that have symptoms like or conditions like asthma, eczema, or even environmental allergies that are not getting better with over-the-counter medications. So you both started treatment over 10 months, exactly 10 months ago today, actually. When I checked, I was like, wow.
Oh,
And
wow.
so, what would you say has been the biggest change you and your child have noticed? You first and then your child. And when did you start to notice changes?
So with me, I stopped sneezing. Like, I mean, it was like so clear. It was a clear difference from what I was suffering, and after I started taking the drops, I I think it's reduced drastically. I almost maybe stopped sneezing almost immediately. I would say immediately within a month, or less than a month actually, I realized I wasn't sneezing as much. I didn't have the itchy eyes and watery eyes. And with my daughter as well, slowly the skin started to clear. And even sometimes she would have a bit of flare, but it wouldn't be like a lot. It would just last a day, at the most 2 days, and everything would go away. And, you know, but like you said, we've been using it for 10 months. And honestly, I can say that even sometimes I do miss my drops and things like that. But I can say I think it's the best decision we made, taking the drops, seeking out the treatment and taking the drops, because it's just a clear difference. Um, Over the years, we always just dealt with it. Okay, just take antihistamines and stuff like that. But I can't remember the last time I bought antihistamines. I haven't even thought about it. Now that I think about it, it never crossed my mind to go, because typically I would go to Sam's Club or Costco or something and get those big boxes. But now, no, it's just eye drops. That's all. So thank you for that.
Oh, that's so, and that's why I wanted you to share because, there are a lot of people in that same boat right now where they're going to Sam's Club or Costco and getting like a year's worth of medication just to get through their symptoms. And even with that, they're still suffering. So
Oh yeah.
having an option like this that can truly be a game changer for them. So One of the things that come up for people is, how difficult it is to use the drops, like, use it, remembering, especially for a child, for instance, like how easy is it to use drops? And I know a lot of people choose the drops over the shots because of the convenience. You can do it yourself rather than having to come in and all, not having to get an injection all the time. But what has been your experience with the drops, like in terms of ease of use and that sort of thing?
So the great tip you had provided us was have it beside a toothbrush or have it on your nightstand. I tried both. um, but I think having it right by our toothbrushes really helps because once you're done brushing your teeth, all you need to do is just, just take the drops. So the ease and the convenience of using the drops, that has just been really nice. I don't think if I had chosen the option of the um, injections, the shots, I don't think I would have continued with it. I probably would have stopped. The fact that, it's just drops. I don't like the taste of it. And the taste of it is just maybe within a few seconds, 2, 3 seconds, the taste just disappears and you don't taste it anymore. It just melts into your under your tongue. But besides that, 2, 3 seconds are kind of it's for me you won't even notice. After a while you get used to it, right?
Yeah.
So the convenience is really, really what makes it a lot easier than having shots. And even with my daughter as well, she has as her own drops as well beside her toothbrush. So for her, she actually does better than I do.
I didn't want to call you out, but
She does.
yeah, she's doing a
Yeah,
great
she
job.
does.
She's
Yeah,
doing a
she's
great
a lot
job
better
with
than me.
it.
Yeah,
Yeah.
yeah. But besides that, it's just more convenient for us to use the drops than going the option of the shots.
Yeah. So thank you for sharing. So, the main benefit of treating with allergy immunotherapy, which is with shots or drops, is that it can actually change the course of the allergic disease. So it treats the root cause, not just symptoms. And so your tolerance is being built, over time. And here at InTouch, my priority has always been to treat root cause and to address the underlying conditions rather than just adding medication. So when I found an evidence-based opportunity to reduce and limit medications, I always try to offer it to my patients. So allergy drops really offer this opportunity to many people. And so you can stop or you can limit using over-the-counter medications in a few months, like you have just heard. So thank you, Banke, for sharing yours and your daughter's story. This has been so, so helpful. Thank you for coming.
And thank you so much for the services, the awesome services and the treatments you provided my daughter and I. We're grateful for that.
Thank you. So if
Thank
you
you.
or someone you know anywhere in Texas has allergies, asthma, eczema, there are treatment options that are highly effective, but are also painless, flexible, and convenient. Allergy drops are perfect if you don't like getting injections, if you're busy, if you travel, if you want to limit the use of medications, it's safe for children and adults. So if you like to get tested or you want to get treated for allergies or you just want to learn more, the next steps are pretty straightforward. If this has helped you, help someone else by sharing this video. And then you can contact us for testing and treatment. You can call us or text us with the number in the caption. You can schedule a 15-minute free consultation with me online to learn more. So I hope that helps. Imagine feeling like Banke here, just, breathing comfortably, no longer sneezing, sleeping better. Imagine being like her daughter. You don't have, I remember, her eyes were like really, closed up when I saw her, her skin cleared up. So allergies are worth addressing. So I hope you take time to address it if you have them. All right. Have a great day.
Thank you. Bye bye.